It's day 2 of the 21-day nationwide lockdown, and the government is doing all it can to battle the coronavirus outbreak. There is police on the roads to ensure that people don't venture out. But one sector that we haven't quite talked about in any of the episodes of Government Matters ever since this pandemic broke out has been the armed forces. What are the armed forces doing? How are they tackling the coronavirus scare within themselves, and what are they doing to help the government in controlling the situation, if at all? Let's find out in Government Matters in this live edition, in fact, with Snehesh Alex Philip, who, as you know, covers defense for The Print. Please send in your questions. He'd be very happy to answer them. Snehesh, to begin with, has the Army or the Navy or the Air Force, have they issued any guidelines to their own forces as to how to deal with this pandemic?
Well, ever since this pandemic has broken out, the armed forces, that is the Army, the Air Force and the Navy, have issued directions, and certain protocols have been changed as far as to ensure that there is no spread of the coronavirus in the fraternity as such. So if you're asking specifically what kind of directives have been issued, for example, in the Army, all unnecessary movement has been completely put to halt. The morning exercises that was initially trimmed down has now been completely put on hold again. Along with that is the fact that special precautions have been taken. The Army headquarters and the various other headquarters of the military is now working with bare minimum staff possible to ensure that there is no spread of the virus. And also another important thing is the fact that which has just come to light today is the fact that even all those JCOs and ORs, that is the other ranks who are set to retire by this month end, will not be able to leave their station while they would be struck off the rolls. They'll continue to remain at the particular station they were in till this particular lockdown is completed. The Air Force too have issued a number of protocols as such to help fight the spread of the coronavirus. Besides that, the Navy itself has done so. Remember that the Navy has a lot of ships out at sea. All the ships have been asked to completely, not to carry out any kind of port calls, and all kinds of replenishments are supposed to be done at sea itself, rather than visiting any ports. So yes, so there are a lot of steps that have been taken by the military as such to keep itself safe from the coronavirus.
And in fact, I'd like to tell our viewers that we want our show to reach as many of you as possible. So we are going to go bilingual increasingly as far as Government Matters is concerned, which, as you notice, we're also doing with Cut the Clutter. So we'll be happy to take some questions in Hindi as well. Snehesh, if that's okay with you. जी स्नेहेश, तो अगला सवाल यह है कि अपने लिए जो आर्मी या नेवी या एयरफोर्स कर रही है खुद को कोरोना वायरस से सुरक्षित रखने के लिए, ताकि वो संक्रमित ना हो, लेकिन वो सरकार को किसी तरह से मदद कर रही है? क्या सरकार ने आर्मी से मदद मांगी है अभी?
देखो, केवल आर्मी नहीं है, एयरफोर्स, नेवी और आर्मी, तीनों जो सर्विसेज हैं कोरोना वायरस के फाइट में सबसे आगे रहे हैं। स्टार्टिंग से ही क्या बोलते हैं, मैं थोड़ा इंग्लिश में बात करूँगा, हिंदी
एब्सोल्युटली, बिल्कुल।
हाँ, तो अगर स्टार्टिंग से बात करें तो यह है कि जो सबसे पहले जो क्वारंटीन सेंटर्स जो सेटअप किए गए थे वो आर्म फोर्सेस ने सेटअप किए थे। दैट इज़ द आर्मी एज वेल एज बाय द आईटीबीपी, विच इज़ जो एक पैरामिलिट्री फोर्स है। नाउ ये जो क्वारंटीन सेंटर्स जो हैं, जो बनाए गए हैं, ये क्वारंटीन सेंटर उनके लिए थे जो बाहर से, जो विदेश से जो इंडियंस को लाए गए थे, चाहे वो इटली से हो, चाइना से हो और ईरान से हो। तो आपने देखा होगा अभी तक कुल मिला के लगभग इन क्वारंटीन सेंटर्स में से about 1300 लोग आ चुके हैं, जिनमें से about 320 लोग उनका क्वारंटीन सेंटर से वापस जा चुके हैं। और अभी लगभग 700 लोग अभी भी क्वारंटीन, about 700 लोग अभी, 700 से 1000 लोग अभी भी क्वारंटीन सेंटर्स में हैं। एक चीज़ और इस चीज़ का ध्यान रखना चाहिए कि ये जो क्वारंटीन सेंटर्स हैं जहाँ सेटअप किया गया वो है मानेसर में है, जैसलमेर में है, मुंबई में है, ये हिंडन में है जो दिल्ली के पास है, पंजाब में भी सेटअप किया गया है। इसके सिवाय तीनों सर्विसेज ने काफ़ी और भी सेंटर्स उन्होंने सेटअप कर दिया गया है जो अभी तक डिप्लॉयड नहीं है। तो उनका ये कहना है कि अगर गवर्नमेंट जो है, सरकार अगर उनको कहती है, ऑर्डर करती है, तो ये क्वारंटीन सेंटर्स इमीडिएटली डिप्लॉय भी हो सकते हैं। तो ये जो क्वारंटीन सेंटर्स है, इनकी भी कैपेसिटी लगभग कुल मिला के जितना भी चल रहा उतना ही है।
So I've started getting some questions, and in fact, this is a question I wanted to ask as well. This is from Rajneesh Kumar. Have the soldiers on leave been asked to return to service or stay back?
वेल जो सोल्जर्स हैं जो लीव पे हैं उनका वो एज आई सेड कि ऑल एसेंशियल मूवमेंट जो नॉन नेसेसरी मूवमेंट वो कैंसिल हो गए हैं और जो अभी लीव्स में है फिलहाल लीव्स में है लेकिन आर्मी में एक चीज़ आपको ध्यान रखना पड़ेगा कि आर्मी अभी तक डिप्लॉय नहीं हुई है इस कोरोना वायरस के लिए फुल फ्रंटल इन द सेंस दैट इट इज़ नॉट अ मिलिट्री ऑपरेशन ये आपने सवाल हिंदी में पूछा था इंग्लिश
मैंने इंग्लिश में पूछा था, आप जवाब किसी भी भाषा में दे सकते हैं.
अच्छा ठीक है तो यू नो you'll have to remember the fact is that you know since there is no movement that is allowed so people who are on leave continue to remain on leave but at the same time also remember that you know their leaves can be cancelled anytime that the military wishes it to so it's not that you know you if you're entitled to 21 days leave you will get those 21 days leave so even if you know it's even if it's your first day of the leave the defense forces can immediately requisition you back to their center.
There's another question, this time from a viewer called Manish Kumar. Have all services selection board interviews been cancelled?
Well, Manish Kumarji, you're absolutely right. All the selection board interviews and everything has been put on hold. You know, it has been postponed. So I would not use the term cancellation. It's the postponing is a term, and as and when the situation improves in the country, the services will come out with the fresh new dates for these.
There's a question from Drake Vision. Is the army also working under 5% of workforce at their offices?
Well, Drake Vision, you know, Mr. Drake, the fact is that the army headquarters and the command headquarters are working at you know a strength of 5 to 10%. You know that's the aim that they have for themselves. But if you're asking if the army as a whole is working on it, then absolutely not. There are a number of active borders, including the LOC, the LAC that are there. There are operations that have been carried out in the northeast and in Kashmir also. While non-essential movement have been restricted, the fact is that there is no you know there is no downward spin as far as operations or operational capability is concerned.
लेकिन क्या फोर्सेस में चाहे आर्मी हो, नेवी हो या एयरफोर्स हो, फोर्सेस के संक्रमित होने की कोई अभी तक कुछ आंकड़े हैं, कुछ रिपोर्ट्स आई हैं?
वेल एक ही केस अभी आया है जो लद्दाख में हुआ था जिनका क्या हाल था लद्दाख जिनमें एक सोल्जर जो थे एक सिपाही जो थे वो छुट्टी पे गए हुए थे उनके जो पिताजी हैं वो ईरान से वापस आए थे उनके ये 27-26 फरवरी को उनके पिताजी वापस आए थे और सोल्जर जो छुट्टी पे था उसने 1-29 को ज्वाइन किया था दोबारा फोर्स में आर्मी में उनके पिताजी को क्वारंटीन में रखा गया था बाद में उनके पिताजी को पता चला कि वो कोरोना पॉजिटिव पाए गए हैं एंड तुरंत उनका जो बेटा था जो क्योंकि वो उसी एरिया में पोस्टेड था तो वो अपने फैमिली का भी देखभाल कर रहा था तो उनको भी फटाफट क्वारंटीन में लिया गया एंड बाद में उनके रिजल्ट्स पॉजिटिव आए हैं तो एक पहला केस हुआ है उन्होंने साथ में जो फेलो सोल्जर्स थे जो लद्दाख रेजिमेंटल सेंटर पे जो साथी थे उनको भी क्वारंटीन पे भी रखा गया है
Pratyush Singh, I'm sorry, wants to know, is there an option that the armed forces will be used during the lockdown? This is a question from a Twitter viewer. And I have a related question, so let me ask that together. It's from Narendra Rotela, who says, is it okay to use the army instead of civil authority for law and order? I think these are two related questions that they mean the same thing.
Well, you know, Rotela Saab and Mr. Pratyush, the fact is that the army has right now not been used, but the army can lawfully be used for any kind of national emergency. And the fact is that this is a war that has been fought. This is a war against corona. And the entire nation is a 21-day lockdown. So it would be absolutely fair and legal for the government to deploy the army. Remember that the armed forces, remember that the defense forces not only have to be deployed only for law and order duties, you know, there are a number of capabilities that only the defense forces have and which the government is should actually do. On this part, actually, I'm writing my column tomorrow on which is Brahmastra and on the same issue itself.
Right. No, in fact, as you mentioned, the army is also called in during natural calamities, etc. So it's not just about law and order; it's other issues in which the army is equipped to deal as
I
well.
would just like to add a point to this. Remember that, for example, in Maldives, there was a team there was a medical unit that was sent, which consisted mainly doctors from the armed forces that were sent. They are now back. The Navy has actually put two ships on standby for deployment to help any of our neighboring countries who might seek India's help as far as the fight against corona is concerned.
Right. There's a question from Nikhil. What steps has the Navy taken to counter coronavirus as sailors live in close quarters on board ships? There was a case in the US Navy.
Yes, Nikhil, you're absolutely right. There have been a number of steps that have been taken. As I mentioned earlier, it seems that you've logged in now, but I was earlier talking about the steps taken by the Navy. For example, the first step that has been taken by the Navy is for the ships which are out in the sea. There are no port calls that would be made. It's only in under extreme case of emergency that these port calls can be made, and this is purely for replenishment purpose, and that too also it has to be done with minimal contact possible and not with larger crew out in the port. All the replenishments are supposed to take place at sea itself. Now, what happened on this USS aircraft carrier Roosevelt, which is a Nimitz class carrier, this is one of the largest aircraft carriers in the world. It's a nuclear powered one, has over 1 lakh ton displacement. Three sailors have tested positive for coronavirus. Now remember that these aircraft carriers are like it's like a city on the move in the water. So it has a strength. It's about 5,000 personnel on board. So it's a large. So in a small space, you have about 5,000 people living there. So it's like a. So if there is any spread, if there's any outbreak or anything of a communicable disease, the Navy personnel are at the maximum risk because then it gets spread a lot. Now and hence it is a matter of concern. And this particular incident, which is the first, has been noticed by navies across the world, including that of India.
In fact, I'm getting prompts from our back-end team that we have a line of questions, several interesting ones. So I'll try and take them up very quickly. Sandeep wants to know, is the Army getting any help from various labs of DRDO for this fight?
Well, the DRDO is separate from the Army, Sandeep. But remember that the DRDO lab, the DRD in Bhopal, has now been given the requisite authority to carry out the test of the possible coronavirus suspects. Now, my colleague Amrita would be soon has written a story which would be published on our site soon about how the armed forces are now involved also in the testing of possible samples of possible suspects of coronavirus. So do log into the print and read the copy by my colleague Amrita.
मनीष कुमार जानना चाहते हैं, हमारे हिंदी के दर्शक हैं, आर्मी कितनी कैपेसिटी में आर्मी हॉस्पिटल तैयार कर सकती है जहां तक बेड कैपेसिटी का सवाल है?
देखो, एज फार एज आर्मी आर्मी के जो चाहे वो आर्मी हो, नेवी हो, एयरफोर्स हो, इन तीनों जो सर्विसेज हैं, इनके अपने ही खुद के काफ़ी क्लिनिक्स और हॉस्पिटल्स हैं. एंड जो मिलिट्री हॉस्पिटल्स और मिलिट्री डॉक्टर्स हैं, बिसाइड्स द हॉस्पिटल्स, उनके जो मिलिट्री डॉक्टर्स और जो ट्रेन असिस्टेंट्स हैं, उनकी ट्रेनिंग ऐसे दी जाती है कि कम समय में बिना ज़्यादा फैसिलिटी के परफॉर्म करने की उनको ट्रेनिंग दी जाती है. बिकॉज क्या होता है कि उनको जहाँ पे उनको एक्चुअल में ज़रूरत पड़ती है वो लड़ाई में, जंग में ज़रूरत पड़ती है. तो जंग में जो क्विकली उनको मेक शिफ्ट हॉस्पिटल्स, मेक शिफ्ट कैंप्स जो सेटअप करने पड़ते हैं, विदाउट बिल्कुल जंग, गोली बारूद के बीच में उनको काम करना पड़ता है. तो दे आर एब्सोल्युटली, वो काफ़ी ट्रेंड होते हैं इन चीज़ों के लिए, एंड इसी चीज़ के लिए उनका अच्छा इस्तेमाल भी हो सकता है.
एक और जुड़ा हुआ ही सवाल है स्नेहेश. समीर जानना चाहते हैं, क्या इंडियन आर्मी कोविड-19 को लेकर कोई रिसर्च कर रही है, कोई नई रिसर्च हो रही है क्या आर्मी के भीतर?
नहीं, आर्मी के भीतर इफ अगर आप रिसर्च की बात करें, मेडिकल रिसर्च की बात करें, तो मेरे पास ऐसा कोई इन्फॉर्मेशन नहीं है कि आर्मी इन पर्टिकुलर मेडिकल रिसर्च कर रही है कोरोना वायरस को लेकर. बट यह है कि हाँ, आर्मी कॉन्स्टेंटली स्टडी कर रही है, मॉनिटर कर रही है कि कैसे अपने आप को जो इस कोरोना वायरस स्प्रेड से बचाया जा सकता है. और कॉन्स्टेंटली उनका एक इंटरनल स्टडी भी हो चुका है, और उन्होंने काफ़ी सारे प्रोसेसेस ऑलरेडी इन प्लेस हो गए हैं, जिसमें से वो देखते हैं कि अगर कल चाहे सरकार अगर आप मिलिट्री को डिप्लॉय करती है तो किस तरीके से जल्दी डिप्लॉयमेंट हो सके, जिससे ज़्यादा से ज़्यादा जो फाइट है कोरोना के खिलाफ वो और सख्त हो पाए.
अब आखिरी दो सवाल मेरे पास, क्योंकि समय की कमी है हमारे पास थोड़ी सी, दोनों जुड़े हुए हैं तो मैं एक ही श्रृंखला में पूछ लेती हूँ। रोहित पावा जानना चाह रहे हैं क्या कोरोना ऑपरेशन की वजह से टेररिस्ट और नक्सल्स के खिलाफ ऑपरेशंस बंद होंगे, और साथ ही में निशांत अग्रवाल का सवाल है, ये अंग्रेजी में है। डज द यूज ऑफ द आर्म फोर्सेज एवरी वंस इन अ वाइल इफ सच emergencies arise show a failure of our health infrastructure? So essentially, does deploying or does diverting the army from their core function, the first question is, that affect what they're supposed to do otherwise, and does it also show the failure of a civil side?
मेरे ख्याल से सवाल हिंदी में था, आपने इंग्लिश में पूछा तो मैं, अच्छा ओके। तो एज आई सेड, मैं इंग्लिश में दोबारा जवाब दूंगा। जो कोर ऑपरेशंस आर्मी के कंसर्न, आर्मी के कोर ऑपरेशंस क्या है, इज टू प्रिपेयर फॉर ए कन्वेंशनल वॉर, जंग के लिए। और जो हमारे एलओसी में है और हमारे एलएसी में है, जो चाइना के साथ है, एलओसी पाकिस्तान के साथ है, और नॉर्थ ईस्ट में है, वो ऑपरेशंस अभी भी कंटिन्यूड हैं। ये ज़रूर है कि मूवमेंट्स रिस्ट्रिक्ट हो गए, तो ठीक उसी तरह इवन टेररिस्ट मूवमेंट्स भी अगर मैं कहूँ तो वो भी काफ़ी रिस्ट्रिक्टेड हो गए। आपने एक प्रिंट के वेबसाइट पे एक स्टोरी पढ़ी होगी, जो आइसिस है, आइसिस ने एक नया ऑर्डर निकाला है अपने जो टेररिस्ट के लिए, और उन्होंने बोला है कि जो कोरोना इन्फेस्टेड कंट्रीज है वहाँ पे वो टेररिस्ट ना जाए। तो एक तरह से देखा जाए तो मूवमेंट की रेस्ट्रिक्शंस हैं, बट ऐसा नहीं है कि कोई ऑपरेशनल कैपेबिलिटी पे किसी प्रकार का प्रभाव पड़ा गया। और दूसरा सवाल क्या था?
जिस सवाल की तरफ वापस जाना पड़ेगा। हाँ, ये सवाल था कि निशांत अग्रवाल जी का था, डज द यूज ऑफ द आर्म फोर्सेज एवरी वंस इन अ वाइल इफ सम emergencies arise show failure of a health infrastructure of the civil side?
Well, Nishan, that's a very good question, and this is something that has always, troubled the military as such. When a military is used for construction of a foot over bridge, in Bombay, and not during the Commonwealth Games when the bridge collapsed and they suddenly had to make a new one quickly. But when the army is deployed to carry out, when the child gets stuck in the borewell, and the army is deployed, at that time it does raise a question mark on the fact that why is the army being deployed? It raises a question mark on the capability of the civil infrastructure. There is no doubt about it. But the fact is that if the military is being used in a crisis like COVID-19, there is no what do you call, no one can really question this particular move, because the militaries across the world, be it in the US, be it in Spain, Italy, even China, for example, not many people know that the Chinese PLA played a huge role in China's, fight against coronavirus. For example, in Wuhan, the entire supply of essential items, as well as that of the medicines and all, was taken over completely by the PLA, different branches of the PLA, including the medics. So there is no problem if the armed forces are right now, involved in this fight against coronavirus, because remember that this is not just a fight, this is a war that the country is waging, a war against the unseen enemy.
Right, so it has to be on a war footing, as you mentioned. I know I said these would be the last questions, but I do want to take this one last question from a viewer, Pratyush. Can the armed forces be given shoot-at-sight orders if deployed by state governments? I want to take this question because I know there would be a lot of misinformation spread on this front. There are lots of people who might have the same question, because there is a state and a particular state chief minister who has talked of shoot-at-sight.
Well, remember that the army cannot be deployed at the, in the sense, of course, the army can be deployed, but remember that for the army to operate, it needs to be declared as a disturbed area first. So a shoot at sight, at the end of the day, the army is only trained to shoot to kill. The army, the soldier doesn't walk with a danda like a constable. He has a gun and he's trained to shoot, and he's trained to shoot to kill. So yes, but it all depends on how the army is deployed and on what basis the army is deployed. As I said, for example, there was during the Haryana crisis, the army was deployed for carrying out flag marches, but the army was not able to open fire when they came face to face with some rioters, because the area was not declared as a disturbed area, which means that the army men did not have a blanket.
We're talking about the agitation for Jat reservation.
So the army, the soldiers didn't have a blanket. What do you call, in the sense, they couldn't really open fire and get away. They would have been, they would have later been legal challenges that these soldiers would have faced. So yes, so there are a number of factors that go into play. But I hope the situation doesn't come to such an extent where any security person, for that matter, has to open fire on civilians.
No, actually, as he pointed out, the situation hasn't reached there yet, and let's not spread panic in terms of talking about shoot at sight at this point, as we've repeatedly said at the print, through our various shows and platforms. Just be cautious, stay indoors, and no such situation will arise. Thank you so much for watching Government Matters. हमारा कद्दक लाटा का लाइव आएगा 5 बजे शेखर गुप्ता जी के साथ. आप उसके लिए जरूर ट्यून इन कीजिएगा और अपने सवाल भी भेजिएगा.